Hello, my name is Sam and welcome to Medicine and You. Today I would like to talk about medical marijuana, some side effects, and some drug interactions. I had the privilege of visiting a medical marijuana dispensary and found out that the people selling the marijuana basically showed different ways to take it. They were showing basically there's rubs, you can inhale it, there's different types of edibles, but they really weren't discussing the side effects or drug interactions of medical marijuana. So as a pharmacist, this was concerning, and I thought I'd make a video about it and let you guys know. So the side effects that you can feel of medical marijuana are vasodilation. You see this a lot of times when people take marijuana and their eyes become red and their blood vessels dilate. Fatigue and dizziness, and then you're going to have psychoactive effects, euphoria, kind of that high, and dry mouth. The vasodilation, where this would kind of be of concern, is if you're taking a blood pressure medication. If you're taking the blood pressure medication to reduce your blood pressure and the medical marijuana is reducing your blood pressure, you may need some type of adjustment there. So again, and this is with all the medications that I'm recommending, talking about today. Just have a conversation with your physician. Let them know you're on medical marijuana. Let them know that you're concerned about some side effects that may occur with it, or some drug interactions, and let them know that, just bring up the concern to them and see if there needs to be some type of adjustment one way or the other. And another aspect is when you have vasodilation, the heart rate can increase. So if you're taking medical marijuana and your heart rate increases and you're taking a medication for your heart rate, again, you're going to have a conversation with your physician and see if some type of adjustment needs to occur. Also with vasodilation, if you're having migraines, the blood vessels inside your head actually increase in size, and you can take medications that actually decrease them. And if you're taking the medication to decrease them in size and then you're taking the medical marijuana that increases them in size, you're going to get more migraines. So have a conversation with your physician and see if there's some type of adjustment that can occur, or possibly a reduction in how much medical marijuana you're using. Fatigue and dizziness, that can go with an assortment of different types of medications. The migraines we were just talking about, any of the triptans and stuff like that can cause fatigue and dizziness. And then if you're taking medical marijuana on top of that, it can cause you to be fatigued even more. If you're taking medications for sleep, and you may be taking the medical marijuana to help you with sleep, that would be a situation, you may be able to come off that medication for sleep and just use the medical marijuana. Again, just have a conversation. Another type for fatigue and sleep is pain. So again, you may be taking medical marijuana for pain, and you're taking another medication on top of that for pain. Well, you may not need that, or you may need a lower dose. Just have a conversation. The other ones are if you have mental illness and you're taking like a tricyclic. You may even be taking tricyclic for sleep. Have a conversation with your physician or a psychiatrist and just let them know you're taking medical marijuana and you may not need such a high dose or none at all. The other ones, the paranoia and the psychoactive effects that come along with with medical marijuana. The biggest concern for me there is schizophrenia. If you have schizophrenia, before you take medical marijuana, I would recommend that you talk to your physician or psychiatrist and let them know. Dry mouth, not really a whole lot you can do there. Taking some water, several times a day. Keep a bottle of water with you. Taking candy, having that around, definitely a thumbs up. Want to get back to the dizziness and the fatigue. Operating big machinery, a car or any lawnmowers or anything like that. Basically, I would caution you anytime you're on medical marijuana from using any of those types of situations. Now, going to get into some medical marijuana drug interactions. The first one I want to bring up is Warfarin. So if you're taking Warfarin and you're taking medical marijuana, when you take the medical marijuana, it could possibly make the Warfarin work better. So if you're using this, just have a conversation. You may have to have some labs drawn to see if the amount of Warfarin inside your blood is higher. The level is higher than it needs to be, because that can increase bleeding. Just a little cup Warfarin causes it to bleed as is, just a side effect of Warfarin. But if it's higher than it needs to be, that actually increases. And the big concern there would be any type of bleeding inside the body, possible stroke. So definitely have a conversation with your physician if you're on Warfarin. Now, the two medications that I know of that medical marijuana causes a decrease in their effectiveness is Theophylline and Chlorpromazine. Theophylline is normally taken for asthma. So basically that could cause you to have an asthma attack. So again, have a conversation with your physician and see if you need to be on another asthma medication or a different dose. Chlorpromazine is normally taken for migraines or nausea and vomiting. So basically it would decrease the effectiveness of the drug. So maybe you need to switch or a different dose again. Now, there's actually a decent amount of medications that I know of that cause an increase of the effectiveness of medical marijuana. Amiodarone, cimetidine, azoles. So if you have a fungal infection and your prescriber gives a medication that has an AZOLE at the end, have a conversation. Maybe you need to decrease the amount of medical marijuana that you're taking. Then fluoxetine and fluvoxamine. All right, guys, that's the end of my video. If you like this video, please give me the thumbs up. If you'd like to see more of these videos, click the subscribe button. And if you'd like to leave a comment below, and I'll try to get back and give a reply to all the comments. And have a healthy and prosperous day.